Green light laser ablation of the prostate for enlarged prostate and lower urinary symptoms. This is Jared J. Wallen, MD, board certified urologic surgeon and men's sexual health specialist. You can find me at mhurologytriad.org, at jjwurology at twitter.com, or at jaredjwallen at facebook.com. This slide depicts why enlarged prostates cause urination symptoms. As you can see on the right hand side of the screen, this is a sagittal cross section of the male pelvis, showing the length of the urethra all the way from the bladder at the top to the urethral opening at the tip of the penis. Ultimately, if you look on the left side, that shows the enlarged prostate and hyperplastic tissue obstructing the channel of the prostatic urethra, causing urination symptoms due to obstruction of the urine path. BPH, enlarged prostate, and lower urinary tract symptoms is a very common problem. Approximately 50% of the men over the age of 40 will have issues with this. Typical symptoms include things like slow stream, intermittent stream, urgency or frequency of urination, urinary tract infection, bladder stones, blood in the urine, urinary retention or incomplete emptying requiring a catheter, and possible dribbling or nighttime urination. Most patients considering this procedure have already tried oral medications. Typically, you would need to consult with your urologist to rule out other causes of lower urinary tract dysfunction. You would also typically need a diagnostic visit with a cystoscopy, uroflow, and ultrasound of the prostate. The picture in the upper right corner of this slide shows cystoscopic views from inside the prostatic urethral channel on the bottom and inside the bladder looking back at the prostate and bladder neck on the top. The red arrow depicts the median lobe of the prostate. You can see this patient has very small lateral lobes but does have a sizable median lobe, which is causing most of his obstruction. The red arrow on the top picture also depicts the median lobe from inside the bladder neck. When we look at the four circular pictures at the bottom, this shows the different configurations of the prostate channel. The top left shows an open prostatic urethra with free flow of urine. The bottom left shows bilateral lateral lobe hypertrophy. The top right shows middle lobe hypertrophy only. And the bottom right shows trilobar hypertrophy with obstruction from both the lateral lobes and a median lobe of the prostate. As previously mentioned, we use both the size of your prostate as well as the architecture of the inside channel, lateral lobes, median lobe, both, as the determinants of which procedure or surgical intervention is best for you. Anyone with lower urinary tract symptoms secondary to an enlarged prostate can undergo green light laser ablation of the prostate. However, specific indications include folks who have large volume prostates greater than 80 to 100 cc's, moderate to large median lobes, or complex issues such as severe urinary retention, or possibly even the inability to come off their anticoagulation medications or the use of anticoagulation medications and need for this procedure as well. Pre-surgical preparation includes controlling medical problems such as diabetes and high blood pressure. Typically, a recent chest x-ray and EKG, as well as labs and a negative urine culture would also be required. We typically would do medical or cardiac clearance as necessary, and we also ask for smoking cessation 6 weeks prior to surgery. We also ask that our patients follow a healthy diet and perform 40 minutes of cardiovascular activity daily. Finally, most patients would stop their blood thinners such as aspirin, Plavix, Coumadin, Xarelto, etc., and this would be done at the direction of their cardiologist. In certain situations, we are able to continue blood thinners and still perform this procedure. This is the typical setup in the operating room. As you can see in the top right-hand corner of the screen, there is a monitor which projects the picture from the cystoscope that I can view and watch while I'm performing the procedure on the inside of the bladder and prostate channel. In the bottom left and middle portion of the screen, you can see myself, the surgeon, directing the laser through the cystoscope, which I can view on the monitor in the upper right portion of the screen to follow along and direct the laser treatments. Here you can see live video footage of the operating room. The picture-in-picture in the bottom right-hand portion of the screen is the picture-in-picture that I can see on the monitor equipment when I am performing the procedure. As you can see, we are looking through the bladder, ensuring that we can find the ureteral orifices. You see a small median lobe mound that's in the middle of the prostate lobe, and you also see that diverticulum and trabeculations in the back of the bladder on the right side of the patient's bladder. Then you can see the laser being deployed, and initial firing of the laser fiber vaporizes the tissue with bubbles as exhaust of the vaporized tissue. Initial goals of the procedure are to remove enough of the obstructive prostate tissue in the channel to ensure that we can adequately see with our flow of fluid through the cystoscope the entire time we are operating and lasering. Once this is achieved, we continue to laser the inside of the prostate channel to remove the tissue to allow the unobstructed flow of urine through the prostatic urethra. Here we can see the Viru montana, which is a small mountain or mound at the end of the prostatic urethra. It allows us to identify where the external urinary sphincter is to allow us to avoid injuring this structure while we are lasering the prostate tissue. We can specifically tell the difference between prostate tissue and where the Viru montana is to allow us to help avoid problems with urinary incontinence. The remaining portion of this procedure shows continued laser vaporization of the prostate tissue, which continues to widen the channel through the prostate and allows unobstructed flow of urine from the bladder through the prostatic urethra and the rest of the urethra out the end of the penis. This is typically performed as an outpatient procedure. A Foley catheter is placed for 3 days. Typically, the catheter is clamped with intravesical or intrabladder lidocaine to help numb the area and allow for better pain control afterwards. Most patients would typically be recommended to be light-duty activity for 2 to 4 weeks until their prostatic urethra has time to heal. Studies have shown that green light laser ablation of the prostate is equivalent to TURP at relieving urinary symptoms. We suggest approximately a 50% reduction in symptoms would be achievable. Other studies have shown that green light laser ablation is better than TURP in regards to decreased catheter time after surgery, decreased hospital stay, as well as decreased intraoperative bleeding. There is great durability of this procedure, including less than 5% retreatment at 5 years. Unfortunately, 7 to 10 year data is lacking. Green light laser ablation of the prostate for enlarged prostate and lower urinary symptoms. Again, this is Jared J. Wallen, MD, board certified urologic surgeon and men's sexual health specialist. Thank you for watching our video.